think of flexibility, I think of muscular flexibility.
Sure.
Who would ever have thought of connective tissue and joint
Right.
and that sort
All
of
of the
thing?
above.
Okay, very interesting. I've heard in previous conversations, I've heard you use the word performance. And when I think of performance as it relates to physical activity, I think of your hard, serious, hardcore athlete. But your definition of performance is a little bit different.
It is, and while performance is a word that most people associate with Olympic athletes, with people who are young and driven to excel at a particular competitive sport, performance to me is the ability to perform, to do activities. And all of us want to be able to do specific activities in our lives, whether that is picking up our grandchild, carrying our groceries, chasing after a dog that got away when you dropped the leash. These normal everyday activities, performance is really what allows you to do those activities. So you don't have to be a competitive athlete to value performance. Does that make sense?
Yes, absolutely. Dr. Galen Johnson talks about how after the age of 30, physical ability tends to decrease anywhere from 0.5% to 3% a year. So when you think about over a 10-year span of time, if your physical ability is decreasing 3% a year, that's a really big deal.
That's a lot.
So what I hear you saying is that by engaging in some perhaps strength training, some flexibility, and other aspects of fitness that we don't normally think about, that it can really go a long way towards helping us to achieve the things that we want to do. When I'm 60, I want to climb Mount Kilimanjaro.
Awesome.
So,
my parents actually went to Mount Kenya not too many years ago and climbed Mount Kenya. So on the same part of the world, and they were in their late 50s when they did so. So there's no reason why with ongoing physical activity throughout your whole life, you can't maintain a very high level of function, a very high level of performance.
But really it's more focused on that everyday living, being able to do my activities of daily living, care for myself, care for my family, pick up my grandchild, take care of my groceries, take care of the animals or whatever, and to do it in a way that's safe and functional.
Absolutely.
Okay.
Those daily habits, those daily activities are the things that set the stage for a real test. Think about in an emergency, having to sprint up a set of stairs to rescue somebody from a burning building, to like I say, run across the street to get a child out of the street. Things like that you hope don't happen, but sometimes do happen. And without that physical capacity, without that performance, those are things that you simply can't do. And so while I don't necessarily focus on preparing for the worst, having that broad range of physical capacity and maintaining that over decade after decade means that when you are 60, climbing Mount Kilimanjaro is a perfectly legitimate goal.
Yay!
Absolutely.
Okay, so tell me about how to get started. Many of us, myself included, are a little bit deconditioned. Many of us probably have a little extra tire floating around the middle. How do you get started with this kind of thing?
Well, and that's a really individual question, but I can give you some basic concepts. Ultimately, increasing daily activity goes a long way to managing blood pressure, weight management, flexibility, maintaining strength, maintaining bone density over the course of many years. And so it doesn't have to be a very long, arduous, painful exercise regime. It can be as simple as spending a little extra time going up and down your stairs at home. It can be not putting off scrubbing the floor because you have a hard time getting up and down off the floor, but purposely doing that more often. When you think about what has to happen for you to get from a standing position to getting down the floor, you have to have strength, balance, coordination, flexibility, and you have to put all those pieces together so you don't A, collapse down onto the floor, and B, get stuck there when you get down there. So things as simple as everyday movements, as doing some of those things, standing up out of a chair, is a great way to strengthen leg and hip and core muscles. And essentially that's a very individual question, because what may be very easy for you may not be very easy for me. And ultimately it's that stimulus, that challenge to those muscular and neurological systems that cause adaptation and improvement. So for you to stand up out of the chair 5 times might not be hard at all. But if to do it 25 times, you may get some significant fatigue in your legs, and that's telling you that you're challenging that muscular system, that energy system, and that's going to promote adaptation and improvement.
Interesting. You mentioned the concept of bone health. Few of us think about bone health as it relates to physical activity, but what science is actually beginning to show is that our bones are very much use it or lose it. And the more pressure we put on our bones, the more activity we're engaged in, specifically weight-bearing activity,
Absolutely.
that it actually helps to preserve that bone. So when you look at the devastation of osteoporosis, some of the things that you're talking about can actually help to decrease the risk of that, and in some cases actually improve the long-term outcome.
Absolutely, and you hit on a really key point there about that weight bearing. It's the pressure, the stress of gravity pressing down on our bodies and stressing our bones that maintains that density. The way your body manages the minerals in your bones is very closely tied into the amount of stress and pressure that you put on your bones on a regular basis. And that's why doing specific strength training exercises that increase the pressure put on particularly the long bones of your body stimulate improvement in bone density. If you know anybody who's over the age of 60, you probably know someone who is concerned about their bone density, who maybe has osteopenia or osteoporosis, or maybe has even experienced some sort of functional limitation as a result of a fall, a hip fracture, some sort of bone density related injury. And that is something that gets worse and becomes a larger concern as people age. And so going back to the weight bearing, we spend a very high percentage of our waking hours with our feet on the ground. And a very high percentage of what I do with patients and fitness clients is feet on the ground. It's weight bearing, it's real world scenarios. And while there is some value to other positions, other movement patterns, very high percentage of that is feet on the ground, standing, weight bearing stuff. It's control of our body in space, much like the way we use it in everyday life.